So, should we treat patients the way we want to be treated? It's a very seductive thought, isn't it? You know, this is what we would choose for our mouth, so that's what we should advise our patients to do. But is it really the right way to treatment plan? No, it's not at all. Mostly we start out at dental school treatment planning by treating disease. We do disease-based treatment planning. And then maybe later on we go to some courses and we learn aesthetic-based treatment planning. So facially generated or digital smile design, an aesthetic-driven treatment plan. And there's many other ways to treatment plan. Maybe we could do functional treatment planning. But the problem with treating our patients the way we want to be treated is that our patients are very different people. It would be like if we went to buy a car and the man who's selling us the car has 2 children. And so he wants to tell us that the car that we need is one that can hold 2 adults and 2 children. But maybe we've got 4 children, or maybe we have no children, or maybe we are excited about cars and he's not. So you see, we're quite different to our patients. We're highly educated, we have high incomes, and quite often teeth form a very big part of our life. But the reality is, for most people, teeth don't. That's just how it is. They're not that important to most people. So the best way to treatment plan is to ask the patient about their values and their goals. What do you want? What are your values? And you see, some people might value low maintenance. They don't want to have to see the dentist very often. So treating them for periodontal disease, which needs 3 monthly follow-up, is a bad idea for them because they may just never do it. And so our initial treatment will be wasted. Or they may have high caries rate and they really aren't interested in changing their Coke drinking and sugar eating habits. So doing 25 fillings in their teeth is just a bad idea for them. Or it may be that they're not really interested in straightening their teeth. So doing aesthetic-based treatment planning is a bad idea. So you can see that the patient may have very different values to us. Now they might want to have teeth that are whiter that don't take maintenance. So they might not be a good candidate for whitening. They may be a better candidate for veneers. Because see, if we do something that doesn't meet their goals and their values, then our treatment might be a failure, even though it's excellent. So the best way to treat patients is not the way we want to be treated. It's the way they want to be treated.